Welcome to New Dawn, and thank you very much for beginning your weekend with us. It is Friday, and for all those who are in touch with us on social media, you know that in this second session we are getting into matters the capital city of Kenya, Nairobi. And on matters health, I know a number of you have questions, but it's an easy conversation. Let's catch up with very key voices in studio this morning. Brown Ashira, who is the SG Environmental Health and Public Health Practitioners Union. Welcome to the show.
Thank you so much, Maurice.
Also with us is Geoffrey Mosira, who is the Health Chief Officer at Nairobi County. Welcome to the show.
Yeah, thank you.
Let me start with you, Mosira. Generally, if you were to grade or give us a rate on how the health is in the country. You know, just the other day, TIFA polls, InfoTrack, for example, have been giving some sort of results here and there. If you were to rate Nairobi's health generally between 1 and 10, 1 being the lowest, what would you say, where would you say we are at in the capital?
Nairobi County, saying 1 being the lowest, then we are at number 8.
8.
Yeah.
Why 8?
Let me start by saying that when His Excellency the Governor of Nairobi County was elected, you saw him visiting our facilities within the city. He could walk to our facility, he could find that there is no drugs to many of our facilities. Mm-hmm. He could find that patients are in our hospitals without doctors. We had inadequate doctors, but he took it up first. He ensured that all our facilities have drugs, because we have we had some of the doctors.
All right.
They were underutilized because you cannot treat a patient without drugs. Equipments. He found that most of our facilities had no equipment. He went ahead and ensured that some of the basic equipment were procured. So right now, as we are talking here, most of our facilities are operating at least optimally. Yeah, as compared before. Yeah.
All right, I needed that as we begin, because literally everyone watching, you know, from across board, Bungoma, Busia, Kisumu, they do know at some point in time you are referred to Nairobi, because that's where they believe there are better hospitals, the state-of-art equipment. Let me hear from Brown. Brown, in matters environment, you know, even as the El Nino is, you know, peeping, there's concern about the drainages we have, the seweries, some saying we don't have proper urban planning around the capital that is actually becoming hazardous for human health and the habitats in the county. What are your thoughts on the environment?
Maybe before I dive into your question, maybe to add on my super chief. You know, Nairobi is a hub of Africa. And when you get it right in Nairobi, you automatically get it right in Machakos, in Kiambu. Automatically, because everybody, how many millions of people come in Nairobi on a daily basis? If you look at the population of Nairobi at night and during the day, those are actually very different. You might be surprised to see around 5 million coming during the day, 4 million during the night. Why are they coming to Nairobi? They're coming to seek services. And if the services are not excellent, then I don't foresee a problem. Somebody should come away from Muranga to Nairobi to seek a service. So Nairobi is a hub of Africa. And I think, and you can agree with me, even other counties, other countries are also benchmarking from us. The other day I saw, I happened to have a friend in Tanzania, and he was telling me that, you know, Nairobi, you are doing so well. They think that we are a super capital, which indeed we are, because the governor, of course, with this extent, the governor has done a tremendous job to ensure that we have the right thing at the right time. Now, coming to what you just said, about the El Nino rains and what have you. You know,
whichever the rains.
Whichever the rains. I don't want to say El Nino because I might not be a meteorological person, but you know, we work with the mambo ya kutabiri. Public health, especially public health officers and technicians, we are prepared. If you look at the infrastructure in Nairobi, of course, it's outdated. It's one of the infrastructure is not the new one. If you look at it, it was one that was constructed by the British colony the one that came up in 1963. I'm talking about the sewerage system and the water system in the country.
All right.
And you can agree with me, the population has been growing.
Yes.
And most people, like I've told you, they come in Nairobi to seek for services. And when population is growing, at that point in time when the storage system was being constructed, I think the then government did not envisage a bigger population. But it's important, it's a good challenge, and I think our able governor, through our super chief here, they have put in place mechanisms to ensure that we have an expanded sewerage system through sewerage system and other things. And I want to tell you for free that as public health officers and technicians, we also on the ground to ensure that people don't suffer from cholera and foodborne diseases, because if you look at where we're coming from, our work, our daily routine works to ensure that we have people, we have the sewerage system unclogged, we have everything running so smoothly. So we are going there, and we are not worried about the El Nino rains. In fact, we are telling them they come. Rains are blessings from God, so we have no problem. We are prepared.
Now, speaking of the population increasing and how everybody literally comes here, the word is usually to hustle and to earn a living so you can take care of your people back at home. Pretty much, it's a hub of business. Food, you know, it's important he's mentioned. And I'm not sure you're aware of certain concerns, especially in the restaurants. The number of restaurants we have is mentioned cholera. I don't know how many times inspections are done, if they are still done. You could still at least give us or bring us up to speed on how the inspections are done, if the officers are enough, what ought to be looked at in these particular restaurants before I go in details to specific restaurants we have seen making rounds on social media.
We have a team of public health who are experts in that, and they do their inspection regularly to ensure that our hotels meet the standard.
I'm sorry to interject. Regularly is what time frame exactly?
It's something that is done like it's a routine. There's a team that is tasked to do that.
All right.
And like on a daily basis, we have a team on the ground. Tasked to do the inspections and ensure that what our people are consuming, the residents of Nairobi, is up to standard, and their hygiene, their standards, their environment, where they're cooking their food from, meets the required standards. You have seen, if you go walk around Nairobi, even when the governor came into office, he said that there were vendors who are just operating in our city, selling samosa, mayai, chemisha, without meeting the standard. He had to say that we have to have order. We have to give our people clean food. And so far, the level, we have zero cholera in Nairobi. Zero. Because of the, right now we have zero cholera. My friend can attest, is a public health officer. We don't have cholera in the city.
To
that matter, we need your confirmation.
That is true, unless, you know, we're talking about confirmation of a case. It's up to it's after the health facility to confirm a case. If there is you know that we are guided by laws.
All right.
The international laws, the Public Health Act, the Food, Drugs and Chemical Substances Act. And I want to say this, you know, for an effective health system to operate, there are parameters, there are building blocks. And one of the building blocks is healthcare, and also the governance and leadership and governance. When His Excellency the Governor came into office, he put up a very strong leadership and governance. If you look at the health department, it's the only department in this county that we have actually close to 4 chief officers. You look at the chief officer health services, you look at the chief officer public health, look at the chief officer medical, and then chief officer health and wellness and nutrition. So chief officer public health has done an incredible job, a very good job. By the way, issues to do with restaurants, inspections are governed by law. I want to say something, we do routine inspections. Routine inspection in a way that there's no clear time to do an inspection.
All right. You
can do an inspection when you have a complaint, for example. You can do an inspection when it's a routine work. You can do an inspection when you suspect either an outbreak or something of that sort. So we do not have a clear time frame on when to do inspections. Inspections are always triggered. Actually, it's our daily routine work. I'm not supposed to come here and tell you, Doris, that I have a plan for this and this. What is supposed to be done is that at the ward level, we have ward public health officers. We have the sub-county public health officers, and then we have the director environmental health or director public health, whose work is to oversee and to oversee the operations of all PHOs and PHTs in the county. So, which they are doing a tremendous job. When the chief here says we have a 0 case of cholera, it is true. We have a 0 because we have not reported any. Unless you want to tell us you have one in place. We have not reported any, but what we are doing is we are doing disease surveillance. All right. We are actually doing on daily basis disease surveillance. You know, it's an easy Friday. And we talk about restaurant, we must be very careful. Today, watu wanataka kunywa chupa moja ama whatever, they want to go kuburudika. So we need to also be very clear on when we want to encourage business in the district. All right. We do not want to scare people away and tell them that the restaurants are not safe. Our restaurants actually are very safe. And they're actually very much in order. I want to find out now, follow up on the real action. Law is good. Policies are good. Yes. The officers, if they have the integrity, are great. I'm doing a follow-up on a particular video that has been making rounds. If I could, I would play it. But I don't know, it should have come to you, where someone was eating fish. It had some maggots in it. Maggots, yeah. For situations like that. Now, that particular restaurant has been in operation. It's not a small restaurant. What action ought to be taken? Have you taken any action? Have you validated, you know, that kind of video, or what really happens so that Kenyans have confidence in reporting these matters? Let me just hear from. Okay. Yes. Yeah.
First, I'll say sometimes some of these videos, we have to also be sure if it's a real video, because on social media you see a lot of things.
But that was a real video.
But yes, our team went on site and they inspected, and actually what they found, they didn't find what was on the social media. But I'll say that the team acted swiftly, and they made sure that whatever was seen on the social media, they went to confirm, fact-finding, because you can't just go and close business because you saw a video on social media. So what steps are taken? What really is looked at? When that kind of, because you said sometimes when there is a cause of alarm, the inspection happens. I just want to understand the procedure. Fine, they did not find the exact fish, but what happens after? You see, like my colleague said here, the inspection is a daily job. Yes. So whenever they go on the ground, they go and inspect the facility to ascertain, is it true, the video that was going on social media? Okay. But again, they have to put measures and also ensure that all those facilities, all those hotels meet the standards, so that we prevent such occurrences from happening again. But our team is on standby, and whenever such is reported, they always respond on time to assess, is it true? You know, I still seek more, because is it the staff you look at? Is it the equipment you look at? Is it where it's constructed that you look at? What are you looking at when you say meeting the standards? I'm saying this because if I have to go to town and I'm hungry, the first thing is food. The high cost of living now is getting people to hustle even more. It is water, it is food, it is medical care, because I'm going to be going to hospitals. But let's look at the criteria. Yes. What do you look at? What is the standard that he is speaking about?
Thank you. And maybe, Doris, I want to tell you this. Yes. When you're talking about food, you need to be careful. Yes. Matters to do with the food are very sensitive, especially when it comes to public domain. There are parameters applied in law on when to close down a facility. Yes. And there also are parameters. We have a very effective unit in City Hall called Food and Water Quality Lab unit. And part of our duties as public health officers, we do food and water quality analysis. When we realize, like whatever we're talking about a video, personally I've not seen that video, but I've heard of the video. But if there's such a case... You have not seen it? You know, we don't act on rumors. You have to be very sure what you're talking about. And this one is not to say that we are not doing our job. I want to clear that air. This is not to say that we're not doing our job. Our job, we are hands on the job. And this is what I want to say, is that we have a very effective food and water quality unit that is doing rounds. And in fact, it's part of our daily routine. You know, if you realize there's an issue with, especially, for example, fish, you need to go to that restaurant, take a sample, take to a lab, analyze that lab. There are two levels of analysis. We can do bacteriological analysis, we do chemical analysis. There are a lot of analysis we do, either just to ascertain whether we have either staphylococcus, we have all those things. You get it? The bacteriological analysis, just to establish a lot of things. So when you have that thing, when taken to the lab, we analyze it. Then we either rule out if there's either issues to do with the food poisoning, we either rule out if there are issues to do with the sanitation, we rule out, and other things. And we have asked a very good question about what we check on restaurants. We have a lot of things. When talking about minimum health requirements, we talk about, for example, sanitation, sanitary facilities. Do those restaurants have the requisite for sanitary facilities to warrant them to operate? We are talking about the food stores. Are our food stores clean? Do we have running water, for example, the hot and cold? Because the utensils you must wash using hot water. For us to be able to be sure that whatever, like this cup, the one I'm using, this cup is actually very much in order. So and medical examining, for example, if there are people, the food handlers, for example, if you go to restaurants, you realize most of the food handlers, do they have valid medical certificates? Are they fit to handle food, or rather to handle, to work? So those are the things. Maybe somebody's a carrier of typhoid. I might be serving you here, but I'm a carrier of typhoid. Then by bad luck ni kuambukize. Would you call it a situation, we call that situation a problem with the restaurant, would you call it a problem with the worker? So that's why now, those are the things we actually look at, so that we just rule out anything that can maybe have a problem with the same.
All right, and I just want to now move from that to the hospitals. You were holding quite a position at Pumwani Hospital, and I want to understand, and as far as mortality and maternal deaths are concerned, how much progress we have made, because these are very key, you know, centers and hospitals for especially women, families, which is the ultimate unit. So on that aspect of maternal care and child care within the Nairobi, what would you say?
First, I'll say that our rates of maternal child, as the county government, when the governor took office, staffing was an issue.
Yes.
That's what he started by addressing, the issue of staffing. He went to his first visit to Mama Lucy. He found mothers were sharing beds because of issues of space, which we are addressing. He found that the doctors, the number of doctors, nurses, the care that the clients were getting wasn't adequate. Some of these things he has addressed. He has looked about equipping the facilities, like the theaters. He found one theater operating. Right now we have 3 theaters operating in Mama Lucy. When you go to Pumwani, it was 1 theater that was operating. Issue of staffing, it has been addressed. We have 2 theaters operating. And also, when you look at also the staffing, the care the patients are getting, you see, you can't have a nurse attending to more than 50 nurses, 1 nurse. We have looked at
50 patients?
Yeah.
1 nurse, 50, the ratio, okay.
So the ratio has been addressed. Right now, the mothers who are losing babies that could have not lost has been addressed. At least mothers could walk out of our facilities smiling, because they come to give birth and they go home with a baby. That's what we are looking at.
All right.
So we have addressed some of these issues of the maternal deaths. And looking at also downward referrals, we have a structure of downward referrals. In our level 5 facilities, they address critical cases. Those cases that can be handled at level 2, level 3, maternities, level 4, they're referred downwards, so that we handle critical cases at the level 5 facilities. Yeah.
All right, I know I'll be taking a very short breather. When I come back, I will just, of course, do a quick recap on cases of negligence that are not really new in Nairobi. Speaking of addressed, some of the issues, I believe some are being addressed and are in progress. There's matters of dealing with rogue medics, rogue nurses, which I think is a good Friday to talk about, as we cannot stop then accessing the health facilities in fear. So gentlemen, I'll take a very short breather, but negligence, still a question at the Capitol, will be one of the very key discussions after this break.